All right.
Good morning and welcome to our first of our three-part series in ILC management in the COVID-19 era. Today's topic will be best practices for ILC remote operations. My name is Ron Kermani and I'm a recovering newspaper reporter and a retired public relations executive, having worked for the Albany Times-Union for a dozen years as the chief investigative reporter, and then for the next 30 years in Association Public Relations for both the New York State Public Employees Federation, PEF, the large white-collar labor union here in New York, CSEA, the Civil Service Employees Association, the New York State Trial Lawyers Association. I spent my last 8 years in public relations in the governor's office working for New York State Higher Education Services Corporation. So it's a pleasure to be with you today and to share this exciting workshop. The content of this series is based on responses to a survey conducted by the New York Association on Independent Living, asking about the challenges that you as ILCA directors and staff have experienced during the COVID-19 pandemic. We also want to know how you adapted to operate in the new normal and what support we can provide going forward. We hope this platform serves as a positive resource for all of you to share solutions. Now, just a few housekeeping tips before we get started. Closed captions will be available for this webinar. We're having a little bit of technical difficulty, but you will get them shortly. You'll see a notification in the controls at the top of your screen, and you will select closed caption. Now, after you select closed caption, you will see the captioning at the bottom of your screen. Now, to adjust the caption size, click on the arrow next to Stop Start Video and choose Video Settings. Click on Accessibility, and then move the slider to adjust the caption size. You may choose small, medium, or large. Now, if you have questions during the discussion, please click on the Q&A button at the bottom of your screen and type in your question. We will monitor the questions and relay the questions to our speakers during the Q&A portion of each session. Now, joining us today is Holly Cargill-Cramer. She's Vice President of Governance and Strategy for the Association Development Group. Now, Holly provides Google and social media training for ADG employees and clients. Get this. She's a Google super user, having been a member of one of Google's original beta testing groups during the development of Google for Business a decade ago. Very impressive. Holly is here to lend her expertise in various technical platforms and to help, so to speak, fill in the blanks on options you may not have used or considered. Now we'll begin our roundtable discussion with ILC leaders and staff from around the state. We're going to move through several topics over the next 30 to 45 minutes. Then we'll open it up to the last 20 to 30 minutes for questions and answers. I know many centers have had to purchase equipment for staff, including internet hotspots, within a short time frame to make remote work possible. And I'm sure in some areas of the state, internet access might still be an issue. Boy, I know that for sure. Were there still additional barriers to ensuring your staff had the proper technology to work from home? That's a key question. And if so, we want to know what strategies did you employ to overcome those barriers and difficulties from getting your staff to work from home. Let's talk about that.
So I see that Aileen and Brett are still muted. So if they want to unmute and join the conversation. Brett Eisenberg, you're still muted as well.
Good morning.
Good morning, Aileen.
Morning.
And so Aileen, Brett, and Ori, I think this one is for you, and I'll chime in on anything that I know.
Who wants to start it off? Good morning.
So Ron, did you want to repeat that question?
Yes, I'd be happy to. Yes, exactly right. Many of the centers have had to purchase equipment for the staff, as you know, and including internet hotspots, very, very quickly. And that's to make remote work possible for all the employees and staff. And as we know, in some areas of the state, especially upstate, and I'm familiar with that, internet access might still be an issue. And then we're asking our panelists, were there additional barriers to ensuring your staff had the proper technology to work from home? And if there were barriers, what strategies did you use to overcome them?
So it's Brett. Maybe I'll start off. So I'm actually we're actually downstate in the Bronx, but we also faced a lot of barriers actually with internet access in particular. And so what we started doing was buying staff laptops or tablet computers that had cellular service built in. And so we used the Verizon network. They're most reliable, at least in the city. So that was our biggest technological barrier, was for folks that were having slow internet or Wi-Fi access to get them devices with cellular built in.
This is Aileen. That's a great idea, Brett. We bought hotspots. So we had a lot of technology. Some of our staff went home with their whole desktop array because we ran out of the more portable things. We've been trying to buy them as funds became available. But the hotspots are where we kind of jumped on. And again, like you, Brett, I don't want to be a commercial, but Verizon covers the Adirondacks, really. So, and we're in the Western Adirondacks to the St. Lawrence River. So yeah, so we bought Verizon hotspots. Now, the lesson learned for us after the first bill was to remind staff to turn them off if you're not using them. That got expensive. Yeah, because nobody had them before, so they don't know how to use them. So, all right, so there it is. So there's my internet. So I'm using it. And yeah, that was expensive. So that was a lesson learned for us.
For us, we also made sure that we had an unlimited plan so we didn't run into issues like that.
We have an unlimited plan now.
Hi, this is Ari. Niall's been using LogMeIn for quite a few years now. It allows staff to access their in-office computers from home, either on their laptop or their home computer. One of the benefits is that it's pretty easy to administer for IT technicians. And when it's running correctly, if a computer on your account stalls, you're able to restart it. However, sometimes staff log off incorrectly and it causes their LogMeIn to shut down. And this happened to us almost on a daily basis when we first went remote. So we had to have someone at the office physically restarting those computers. Sometimes LogMeIn will freeze, and it does come at a cost. It's about $3,500 for up to 50 computers annually. As an alternative, we've started moving staff over to a VPN. And unlike a commercial VPN like service that you would buy, this is something that IT set up for a couple of our computers that just created basically a tunnel from their office computer to their laptop at home. And it allows them to access, everything just as if they were sitting at the office.
What we actually did for staff access, we actually moved our everything they had on their computers into the cloud. So our entire server is now in the cloud through Microsoft. And so we don't even need access to our desktops in the office anymore.
Yeah, we're in the process of upgrading, in which case we'll be able to move all of our computers off of LogMeIn, which will be a savings to us. And as soon as we get that, our equipment upgraded, we'll be able to do that.
I just wanted to go back for a moment to the proper technology and the discussion of the hotspots. One of the things I wanted to point out that many people don't realize is that they're, I know that you were talking about Verizon, and I believe I have Sprint, and I believe that there is a similar function with a lot of smartphones these days, that your smartphone can also serve as a hotspot, particularly on Android phones, so that if you are in a situation where even if you normally do have internet service and suddenly find that you've lost it and need to gain access again, there are features on many Android phones that allow you to turn your phone into a hotspot and connect wirelessly with your laptop to that hotspot through your phone. So that's something to consider sharing with staff as well.
The challenge with that is then we're responsible as employers for the data use on the employee's phone. So that quickly became a conversation that we did not want to keep having. So, which is why we went to the Wi-Fi, you know, little other ones, the MiFis, whatever they call them. But yeah, because as an employer with a lot of, you know, I mean, the human services are not well paid. We're not well paid in independent living. So people were like, hey, you know, I only have a 5 gig plan, and you know, my kids use that too, and so I can't be giving it all to you. And I totally appreciate it.
Yep. I know some employers do also provide cell phone service for employees. So if there's a situation where that happens, then that would be a tool.
I have a question. Have any of the companies like Verizon or Sprint come up with plans specifically for association work or for members, such as living centers that are discounted or perhaps improved capability and reliability?
Not that I know of.
Okay.
So Spectrum very quickly was mobilized to install internet in any house that had a child who was trying to go to school.
Right.
So Spectrum jumped on that, and luckily up here, that's kind of been our that is the internet service provider up here.
Yes.
Yeah. So, but I have not learned of anything, and we've been in touch with our representative. We've had a nonprofit account with Verizon for a long time, so we were in touch with our representative, and we did get some of the charges backed off. She was able to back some of them off, saying, "Oh yeah, it was by accident. We understand that. We'll take that off."
Yes, that's just good business practices, it seems.
Right.
Yeah, exactly. Holly, anything you'd like to add, or anybody else before we jump into the next slide?
No, but I believe Denise Figueroa had a comment that was relevant. I believe, Denise, you can unmute yourself and speak if you like.
Yeah, I just wanted to add, can you hear me?
Yes.
Yes.
Yeah, good. All independent living centers, because of our state contracts, should be eligible for government contract pricing, which does reduce your costs over the average business costs.
That's good to know.
And that's probably the nonprofit pricing that they're giving us, Denise. So that's excellent. Thank you.
Very good. That's good. So everybody make sure we get that. Okay, let's continue. And I know that video calls have quickly been part of our new normal, and we've been thrust into being camera ready at all times, as we all know. And there are several popular platforms with both pros and cons. And let's hear from Robert Poulin about Microsoft Teams. Robert?
Good morning, everyone.
Good morning.
So I am by no means an expert on this. I can tell you that Office 365 basically offers pretty much all the tools that you really need for remote work, including a pretty vast number of apps that can be put into play. But Office Teams allows you to basically set up workstations, channels. It is an excellent video conferencing phone calls system. We do all of our staff meetings using it. We are doing any future trainings with it. You can hold a large number of events. The regular conference system allows up to 250 people on the call. And you don't necessarily have to own teams in order to participate, as long as the folks who are managing the call send you an invite. There's also an events feature which allows a much larger group of people in the thousands, as I understand it. There's a very good training system with Office 365, tons and tons of video. You know, I know that a lot of businesses have Office 365, and we pretty much use the Word and Excel products, but there is so much more there. SharePoint allows collaboration on documents that you can work on together in real time. The biggest downside to the entire Office 365, and if you like compare it to Zoom from the articles that I've read for the communications piece of it, they offer relatively the same aspect, and you're going to get the integration of the whole Office system with Microsoft. But Zoom, the big thing that is recognized is that it's pretty much the easiest platform to use. Whereas 365 is pretty complicated. We have to, you know, we've devoted and are continuing to devote quite a bit of staff time to training, and we spend parts of our staff meetings training in the various aspects and programs, apps in 365. But we feel that since we're already paying for the platform, it's all built together. It's all in the cloud. There are HIPAA guidelines to set up security, so it's a very secure system, and it does meet HIPAA guidelines if you put your settings in the proper order. So there's a lot of benefits. The downside is the training.
Good. What else does anybody want to add about this Office 365 or other ways of setting things up?
If no one else has anything to add, I'll talk a little bit about Google Meet.
Okay.
Like Office 365, as Robert was indicating, it's an environment with the 365 is an environment, and the Office products are an environment which so many people are familiar with. Like that, many of us are really familiar with the Google platform and but don't necessarily know all of the tools that are available to us inside Google. Meet is one of those tools. At ADG, we are using it currently for all of our staff meetings and our interactions with each other in the office. ADG is a Google environment. It allows us to share documents seamlessly, provides us cloud storage seamlessly. And the Google Meet environment is a great environment and really easily accessible for meetings. We use our Google calendars with our clients as well as with our staff, among our staff. So if you are a Google user or if you do work in a Google environment, those tools are available to you as well. You can turn on in the administrative features the ability to use Meet, and Google has extended the paid options for Meet to all users, even the free users, through September 20th of this year as part of their effort to help the country deal with the COVID-19 issues. Google Meet is very easy to use. It's attached to our calendar. We can turn on, add Google Meet to features to any business meeting that we schedule on our calendars and launch it directly from the calendar invitation. It is very easy and seamless and simple to use. It allows for us to see pretty much everybody on the meeting. The G Suite version of Google Meet allows you to actually have up to 100 people participating with video on. It sometimes does slow things down, so you have to have a pretty good internet connection to use the video with that many people. But it's really, really easy to use. Very simple and much like Zoom, to the point where they're becoming a bit competitive with each other. The high point of Google is it's free. It is a tool that you do not pay anything additional for. If you're a personal user of Google, you can meet with other people that have Google addresses. If you do have a G Suite account, which can cost as little as $10 a month for a business, or could be free for not-for-profits, because Google does provide their services free to not-for-profits with unlimited use, then Google is truly free. And the use of Google Meet is truly free for you. So it is a great option if you don't want to, or if you don't have the funding to do a Zoom or something like that.
Any other thoughts or comments about Google Meet?
Well, this is Aileen.
Yes.
So we jumped on Zoom, but we purchased the healthcare license, which we were told has better encryption than the regular Zoom meetings. We have to have a signed mutual business associate agreement for protecting health information, and a minimal amount of training, not much training, on managing registrations and waiting rooms. So I'm wondering, is Google secure? I mean, could you have a support group on a Google group, or is it just open format kind of software?
You could have a support group on Google Meet, provided that all the participants have joined through the internet. The place where you lose the security with a Google Meet is if someone comes on the phone. Then you don't have the encryption over the phone line that you would on Google Meet, or I mean, as you would over the internet. So the security is there, but it would require that everyone be using their computers to sign on.
Gotcha.
Any other comments about this? Okay, let's proceed. Despite our affinity for emailing and texting these days, lots of folks, and count me among them, still prefer the good old-fashioned phone call. And Aileen Martin is going to share her experience with Voice over Internet Protocol, or VOIP. Aileen, the floor is yours. Take it away.
VoIP, yeah, that's just kind of a weird thing to say, VoIP. So yeah, Miracle went with Voice over Internet Protocol at least 2 years ago, maybe more, and have been extremely impressed. It is provided through Vonage. It's a business platform that Vonage provides, and it rides on our Spectrum internet. The phones are computers, technically. I mean, it looks like a phone. I agree. I like phone calls too. So the phone looks like a phone. It functions like a phone, but you can plug it in to a Cat5 cable anywhere, and it acts as though it's the phone on your desk. That was one of the things that really helped us go home quickly in March, is that everyone can just pick up their phone, bring it home, plug it in, and you've got, we can intercom each other. Our receptionist can answer the phone at his couch up on Tug Hill and transfer a call to me on the St. Lawrence River as though we were in the same office. It's seamless. It's remarkable. And if you don't have internet access, Vonage has an app that you can put on your cell phone. So your cell phone can do the same thing. And if you are, for instance, talking with consumers, if you use the Vonage app, the call is coming from NERCL. So it never, so your personal information is never disclosed to, consumers when you're using your cell phone, as long as you're going through the app. It really is extremely impressive. One of the things that we learned very quickly when we first installed it, though, is that if you have, in one location, our main office has 33 employees who are all using the internet at, all throughout the day now, you need to increase your bandwidth. Mm-hmm. Your limited bandwidth is not going to cover, because it covered your computers and that was great, but now you just doubled the number of computers basically that are using the internet. So you have to have enough bandwidth at your main office. We found that out quickly. Calls were dropping, calls were choppy, and we couldn't, everyone hated it until we increased the bandwidth, and then the tech guy was a hero again.
Does Spectrum charge extra for that piggybacking?
Nope.
Interesting.
Nope. It charges you for the bandwidth, but you buy bandwidth in like big chunks, and so we're still saving a ton of money over our telephone bill.
Good for you.
So yeah, I would recommend it, and I'm sure that Vonage isn't the only provider, but it was recommended. Vonage was recommended to us by the guy. Like everybody's a guy, like a UPS guy or whatever.
We'll have a guy.
We'll have a guy. So he's our copier guy, the guy who manages our copiers in our office, which is a local business, Advanced Business Systems, said, hey, why aren't you guys using this? And we went, I don't know. And he, took him a while to convince me, but so I'm sure there's other providers.
Yeah. Holly, is there anything else out there? Is Vonage the only provider for VOIP, or are there other companies out there doing similar?
Oh, I do know that in most areas, there are different people. There are some national companies that do VOIP. Here in the capital region, we also use, at ADG, we used First Light.
Oh, yeah.
Yep, that used to be, for us, it used to be Tech Valley Communications, and they're very good and have really expanded their coverage as well. You can find those VoIP providers in different regions of the state. Another option is Google Voice. Google does have a voice over internet protocol and internet phone service that allows you to manage your phones on the internet in an internet browser. One of the interesting things about Google Voice does have a charge if you are a business. Mm-hmm. If you are not a business and you want a personal number, a phone number, it is free. You can use, if you're a personal Google user, you can get a free Google Voice number, and that can be managed online. You can get your your voice messages on the internet service and whatnot, and it can also be used on your Android device. And I point this out mostly because I think, most larger organizations already have their phone situation figured out. But in the case where you don't have a phone that you're taking home with you, in our office, a lot of folks have just forwarded the business numbers to their phone. Mm-hmm. Some people are uncomfortable with that. Some people are uncomfortable giving their personal number to clients. If you have a situation like that, one of the things that you can do as an individual is get a Google Voice number. You can put that Google Voice number on your Android phone and manage that on your Android phone without, and it will still forward to the same phone, so you can have more than one number ringing on your phone, so that you can manage your business calls separately from your personal calls. So it is It's free. It's very easy to manage. And you can just go to Google Voice on the internet to set up a personal number for yourself. If you're interested in using it for at a business level, they have both small business and enterprise levels. I believe small business level starts at $10 per user, and it would have a different line and number for each user, but they're all managed centrally administratively.
Interesting. So there are other choices that work perhaps just as well. Some are free and some are not.
Right.
But does anybody else want to weigh in on Google Voice?
Fred, I just wanted to mention what we use for our phone system is we actually use Microsoft. And so it's part of our Microsoft 365 subscription. And the phone system actually runs through Microsoft Teams. And so we didn't have to physically bring home phones from the office. What happens is, as long as you have the Teams app on your computer or on your cell phone, your phone rings as though you're in the office. And so anywhere you have the Teams app is where it would ring.
Good. It sounds like it works well for you. Any other thoughts about using Microsoft for this part of it?
Well, this is Aileen. I have a question for Brett. Brett, do you guys provide cell phones for your employees, or are you asking your employees to put it on their personal phone?
Most of our employees put it on their personal phone. When we were looking for a new phone system, we actually polled the entire staff, and this is what they chose. The reason they also like their own phones is a lot of our staff have particular phones for their disability.
Right.
And they're more accessible, so they prefer to actually use their own phones.
Good. Anybody else out there with any thoughts on this? All right, let's talk about the big person in the room, Zoom. Let's cue up that beautiful slide here, if we have it. Very good. 2 years ago, if somebody mentioned they were going to Zoom somebody, you would look at them like they were not speaking clearly. And obviously, it was the same with Google. You're going to Google somebody 15 years ago, you had no idea what they were talking about. But boy, if we bought Zoom stock prior to COVID-19, we'd all be retired by now. And that could be a good thought as well. But we know that Zoom is one of the most, if not the most, popular platforms for meetings and webinars, especially these last couple of months. And here's something I did not know before today. It has the capability, Zoom has the capability for encryption that gives an extra layer of privacy for staff or consumer calls. And once again, our resident expert, Aileen Martin, is going to tell us about the encryption with Zoom. Please, Aileen.
Wow. So I'm definitely not an expert on encryption, but what I needed to know, and I called them up. So it was pretty simple, and I told them exactly what we needed, and he said, this is the version of Zoom that you want, and it's a healthcare version, and it has, I don't know, it has the 264 encryption or whatever. I don't know what that means. So I'm really not the resident expert on encryption, but I knew enough to ask for it. I knew enough that I wasn't going to be able to do anything without it, except for maybe have staff visits, and that wasn't going to be enough. Because while the feds kind of lessened some of the HIPAA regulations around telehealth and televisits, New York State Office of Mental Health said, you need to make sure that your visits are secure. So if if it's by telephone, one-on-one on a telephone, then that's how it is. So, so it was a little bit more money, but not much. It was like somewhere around $2,000. We have 52 employees who, I think we have 10 people who can set up meetings for all of them. And so it's not like one central person. We got 10 people they can go to say, hey, can you set up a meeting? We can have meetings with up to 300 people. Mm-hmm. And it's all the same platform. And like I said, it's like $2,000 for a year, which did not seem like a ton of money for me with all of that going on. So we've been using the health, and they sent us the business associate agreement. We had to sign it, send it back. They signed it, so we each have a full fully executed BAA on file. So that's where we went with it.
Good, good. Holly, something else about Zoom with encryption?
Just that I found some of the conversation around the security with Zoom interesting. That a while back there was a big to-do in the news about how Google, which is, I am a Google super user and I'm a huge Google fan, but Google put out a press release that said that they were not allowing their employees to download Zoom onto their computers because of security issues with Zoom, which I found kind of self-serving because Google and Google Meet and Zoom are major competitors. But Zoom has done a fabulous job of addressing security issues as the use of it in so many different capacities has changed. And I know that it was just announced within the past week by the CEO of Zoom that they are hearing what people are saying, because right now the free version of Zoom, if someone just signed on to this meeting with the free version of Zoom, they would not have the same encryption that the paid version has. Mm-hmm. And that's been an issue for some. So the CEO of Zoom has committed they're launching later this month a beta version of the free Zoom, so that even that will be given encryption as long as the user is willing to sign on and provide some identification. And at the beginning of each meeting, then they will provide that level of encryption as well. And that's supposed to launch later this month. So, but certainly for healthcare purposes, you really want to have the paid version with the end-to-end encryption.
Mm-hmm. Mm-hmm. Anyone else about Zoom with encryption? Okay. Now, there are some alternatives to Zoom, and we're going to talk about that for a minute or two. I'd like to ask an open question for the entire group, all of our listeners around the state as well. And I'm asking, what alternatives have you used to Zoom? Give me some pros, give me some cons as well, and anything you would recommend or caution against. Please, let's just open this up for everybody. You can either type them into a Q&A or the chat box at the bottom of your screen, and we'll get those and read those to the group. Let's take a look here.
So I'm going to chime in here, Ron.
Please do.
And talk a little bit and maybe kick off some discussion. So alternatives to Zoom, it depends on what you're using Zoom for. If you're using Zoom for internal meetings or client meetings, direct client meetings, there's some, some platforms that are very similar or could also meet your need. Of course, we've mentioned Skype, mm-hmm. Which is a great meeting tool. And we've mentioned GoToMeet or Google Meet, which is a great meeting tool. But often we're using Zoom for things like what we're doing now, which is really a webinar. And a webinar platform is a little bit different than just a video conference platform. I have used the ones that I like the most are Zoom and GoToWebinar or GoToMeeting. Mm-hmm. That is the GoToWebinar and GoToMeeting are part of the LogMeIn family now, and I find that GoToWebinar is really a very good tool, very similar to Zoom. It's a bit more expensive than Zoom. But it is very easy to use. It has excellent features. It allows in-meeting polling. It has automated surveys. And it integrates with a lot of tools as well. We use a database, membership database called CiviCRM, and GoToWebinar has has a module that integrates with our database, much like Salesforce and Zoom can be integrated. GoToWebinar can be integrated with Civi CRM so that people can register for an event through your website and receive their sign-on information directly from GoToWebinar and GoToMeeting. So there's some great integration tools there, and it's very easy to manage. Other platforms that I've used have included it's Citrix. What am I thinking of? I keep wanting to say Skype. It's not Skype. And forgive me. WebEx is what I was looking for. WebEx is a platform a lot of people are familiar with that's used a lot by the state of New York. I mean, most of the webinars that I've participated in that are sponsored by state agencies have come through WebEx. So it may be a platform that's familiar to you. I find it a little bit clunky and not as welcome to the kind of interactivity that we're seeing more and more on webinars and in presentations. And then I have sort of flight tested another one called Webinar Jam. Lots of bells and whistles in Webinar Jam, and it's really great. But I seem to find it more of a platform for people that are doing sales and marketing. But it is a good platform if you're interested in checking out another one. But those are GoToWebinar, GoToMeeting, and Zoom are probably my favorites of all.
Good to know. Who else in the field wants to come up with some alternatives to Zoom and what they recommend or recommend staying away from? Anybody out there who has some information on that, please? Robin and Holly, I've lost the ability to see the chat box and the Q&A box. So if you want to monitor that for me, I have a...
Sure, I've been watching the chat box.
Trying to update the software here. So I won't touch anything because I don't want to lose anybody. just look at the chat box and the Q&A form if there's anybody else contributing on this?
I'm seeing from Michelle that they use a conference line through their phone provider sometimes instead of Zoom. I am also seeing Denise chiming in saying that they use Zoom now, but tried GoToWebinar and staff did not like it as much.
Okay.
And Robert says Office Teams Events is one of the platforms that they use. And I'm seeing, I can't see the name of the person who put this one in, but it says Ready Talk and On24. On24 is an interesting platform I've just begun to see a bit about. Who is this? If you can identify yourself, it might be Robert, I'm not sure. But if someone's, hi, Robin, do you want to talk a little bit about Ready Talk and On24?
I've only seen On24 used in demos and in webinars that I've attended, and it seems like a really robust platform. But again, we've looked into it, and it's pretty rich for our blood. I've used Ready Talk many times, and it's fantastic. And for people who are not very tech savvy, they have support online for you the whole time, and they actually run it for you. So that's a real benefit if you want somebody to help run it for you and have someone online the whole time. That's a great feature of Ready Talk.
Good to know. Has anybody else used anything else out there?
I think Michelle Wooden had her hand raised.
Oh. Michelle?
Michelle, you may need to unmute yourself.
Oh, she said it's by accident.
Okay.
You're excused. But thanks for thinking of us, Michelle. Okay, well, let's leave Zoom for the moment and buy stock if you can. let's talk about managing bandwidth here. And that seems to be everybody's problem these days. We've all been caught up in the spinning wheel of slow internet connections, and that's familiar to all of us every day. And it's one of the most frustrating circumstances. And it's even more common now with everybody telecommuting. So Aileen is going to share some tips on managing bandwidth and how to get the most out of that. Aileen.
Sorry, I was muted.
There you go.
Yeah, so communicate with your provider. Like I said, as soon as we went on the VoIP with our phones, we noticed we needed bandwidth right away. Managing bandwidth at home is a challenge. And again, that's also why we bought some hotspots for folks, because, you know, as an employer, we have a responsibility for when people are working at home, what are we asking them to do, and what do we reimburse them for, and how to manage that. And bandwidth is definitely an issue when people are now working from home, when, you know, before it was just the kid, you know, kids weren't home doing their homework. Everybody's, you know, at home managing, trying to get on to whatever they can. So, yeah, so my advice is just to have communications as much as you can. And if you're finding that your service is not good, to definitely contact your provider, because sometimes there really are technical problems. It's not just that you need more bandwidth, but there's problems with your connection that having them come and check can correct. So you don't always have to buy more bandwidth. Sometimes you just fix connections. Right.
Or install something, a new wiring or what have you. Yes, exactly. Yeah, that's happened to me. Anybody else on bandwidth? Ollie?
I'm just going to confirm a little bit of what Aileen said and make a couple of suggestions as well. Spectrum, who is the internet provider for a lot of us here in my area, has multiple bandwidth packages available for homes. If you're not sure what speed you're getting, one of the things, or if you think you're having difficulty, I recommend that you sign on to a website called Speed Test. And if you sign on to Speed Test and run a speed test, it will tell you, it will first run a test and tell you what your download speeds are. And everybody thinks about download speeds, and that's that high number that if somebody's talking about your bandwidth or your speeds, they'll give you two numbers. It'll be a 100/10 or 100/20. The larger number is your download speed. That is the speed at which you're transferring information from the cloud to you. Upload speeds are the smaller number, and that is the speed at which you are sending things up to the cloud or over the internet. With video conferencing in particular, it's best to have an upload speed of 20 or more. Standard in a household is 10. But Spectrum does have higher speeds available at very low rates, and they also have upgraded their system, and everybody is eligible for that upgrade for free, but it has not been pushed through to everybody. They were working their way through and pushing that system upgrade to everybody when COVID hit. And then they kind of got taken aside and away from that effort to put time into making sure that other people people got internet access for school and business and things like that. So you may or may not have received that upgrade yet. You might want to do a speed test and then call your provider and say, this is the speed I'm registering at. I'm not sure that I'm currently receiving the highest level of speed that I should be getting from my internet. And it may just be a simple adjustment over the phone, and boom, your speed improves. So I'd really recommend that everybody take a look at what speed they're currently functioning at. then hardwiring is the best, is going to be your best connection to make sure that you're taking advantage of all the bandwidth that you have. In the best of situations with the Wi-Fi router, you're never going to get quite the bandwidth that you're going to get with a hardwire from your modem directly into your computer. Conversely, also, and particularly for Spectrum customers who are receiving internet services from Spectrum, you often are given a modem and router combination that's also your TV, connection and whatnot. And if you've had that for more than a year or two, you have an old model. And you may want to, and it may not function at the same level as the newer models of modem. So now that offices have opened back up, or we have some access to be able to go to and receive service directly from Spectrum, you may want to get an upgrade of the modem that you have in your house. I actually made the choice personally, because we do rent our modems from Spectrum. I made the choice personally to go and purchase my own modem. And for just under a little under $200, I think it was about $185, I bought a new modem router combination that definitely boosted my Wi-Fi reception on my computer. So that I realize that's not an option for a lot of people. So check with your internet service provider to make sure that you have an up-to-date and modern modem and router as well.
Holly, what was that website again? Speed test for the testing your...
Speed test, no space, speedtest.com.
Okay, good. Great. Any other comments or thoughts before we move on?
Yeah, this is Aileen. I wanted to reinforce the last upgrading your modem and router. I just moved in the middle of all this and had Spectrum come and install the whole thing. And as he hooked it up to my wireless router, he said, "Wow, you've had this a while." And it's one of those things that sits on the shelf and it chugs along and you don't have a problem. But right. You might want to improve. You'll improve your connectivity if you just go online and order from one of the anywhere. It's probably the same price as what I paid for that, but it's better technology. So yeah, upgrading your router, like for $89, you can get a much better wireless router if it is that multiple people are using wireless in your home.
Good. Thank you. All right, shall we move on? Let's talk about managing people and the emotional support strategies for staff and consumers. And last but not even least to this adjustment that we've all been enduring has been emotionally difficult on all of us. We've been physically isolated while having to learn to work in a whole new way. And many of us have experienced a loss on a personal and professional level without having the tools to process it. And many of you out there in the field have implemented practices to support your staff and keep them engaged. And Brett Eisenberg and Eileen Martin, I know you have some tips to share. Please, the floor is yours.
So I guess I'll start. It's Brett. What we use is it's actually through our payroll provider ADP. We have an employee assistance line, and so our staff really seem to like having it. And every single staff meeting, we do weekly staff meetings. We remind all of the staff about the line. We give out the number again. So that's been a really useful thing that we have in place. And we don't pay extra. It's literally part of our payroll package. So you might want to, if you use ADP, talk to ADP about your particular payroll package. It's a very, very useful thing that that provides some extra support that, our staff has really been taking advantage of.
Interesting. Aileen?
Well, we also offer an employee assistance program. We do our own payroll. We don't have a payroll program. So it's called ESI, Employee Assistance Program, and their website is theeap.com. It's a catchy little website. But I think we pay $2,000 a year and it covers 50 employees. It's extremely helpful on many levels. Yes, dealing with the emotional toll that COVID has brought to many families, but it also has online training. It has management training. It has personnel training. It has all sorts of tools, online career development training. They also do, I don't think that people understand EAP. They think, oh, someone thinks I have a problem, I have to go to EAP. But they also have financial counseling. So COVID brought a lot of financial challenges to people. So staff and their families, so it doesn't have to be just a staff member, but a immediate family member can call and get assistance with, all sorts of topics, from family counseling to financial counseling to, just anything. It's really been very helpful. One of the things that we also have at NERCL, and this was actually a requirement from the state to provide the home and community-based services that we do, is we have professional supervision for our peers. So we're a peer-run organization. We've only ever had peers on staff. The fact that we even needed to hire a professional to supervise, quote unquote, was just hysterical to me. But we did contract with a local psychologist who has been a longtime fan of NERCL and understands the peer movement. So we have him on contract, and he comes in once a week to do really, it's called supervision, but really it's like one-on-one problem solving and group support for working with folks. So it could be that, I'm working with someone and they tested positive for COVID, and I don't know how to quell my own fears while I'm talking them through it's going to be okay. So he can help with all sorts of things like that. And so that has also been well worth everything that we pay him. I think we pay him $150 an hour, and he's 2 hours a week. He's been well worth it to the support that staff have felt by being able to talk with him in that opportunity.
That's very interesting. Other thoughts on dealing with all of this? Anybody else in the field?
Deborah Worden commented that that isolation is a huge issue in their area. I think that I'm not in a really rural area, but I am in a suburb of Albany. It's not really rural, and even here I feel very isolated, it's a different kind of work environment. You sit down at the computer during the day and it's very quiet, and it's not like being inside an office where there are other people moving around and there's easy access to an occasional distraction. It can be very, you sit down at the desk and you work, and then you stop and you have lunch, and you're doing that in your own kitchen, and then you go back and you sit down at the desk and you work until the end of the day, and then you stop and you don't even have that decompression time, moving to and from the office. So it does definitely have its challenges, and I think taking care of each other and checking in with each other periodically can go a long way towards breaking up some of that isolation. I think, the employee assistance programs are huge, but if just a reminder that we all have to take care of each other as well, I think is great and important.
This is Aileen. I completely agree. And so I have been, as the director, like going through a list and just calling people on their extension saying, hey, it's me. I just want you to know I'm out here, and how are you? And just finding out, just giving them 10 or 15 minutes to they just say, I'm so glad you called, because this is happening right now. So, and it could be nothing, it could be, I can't get the dog to stop barking when I'm on the phone. You just have someone say, yeah, it's okay. Everybody else has that too. It's all right. That has been very helpful, but we also have been getting product through our United Way to share with consumers. So for those consumers who are isolated, because it is far away and you have kids in the house and you don't want to take them out, we've been doing, instead of home visits, we do driveway visits now. So we'll call them up, we'll, find out what people need, and maybe it's toilet paper or paper towels or hand sanitizer or masks. And we've been delivering them to their homes. And that has like become the event, I mean, it's like, it's kind of a Western scene, where it's like, look, Ma, someone's coming down the road. And that's kind of where that's us. We're like, oh yeah, here's Nurgle. We're delivering product. We don't go in anybody's houses. We socially distance, but we do making home visits just so that, because we have a large family support program, but so that those families aren't feeling so isolated like my kids are. Driving me up the wall, or my kids, I'm trying to work and my kids are all over me or whatever. So it's a nice distraction during the day for them to have somebody else visit.
We were talking before the conference started this morning about our trade associations that many of us belong to. And I know it's the same in your profession as well. And without the monthly or bi-monthly meetings that we're so used to going to and connecting with our peers and our colleagues and sharing this kind of information, like what did you do with this and what did you do with that and how did you handle this? That is evaporated. And so you're right, the driveway visits and the visit from the mailman or the UPS drivers become our best friend here in Saratoga Springs. I think he has a mailbox out front here. He's here 3 or 4 times a day, it seems. So you're right, you have to sort of replicate, or if not replace, our normal professional associations as well. And so this is one small step, as you can tell, of us getting together and doing these things and sharing the knowledge that we've come to know, we've come to learn from trial and error. So any other questions or comments from the audience out there, from all of you staff people and directors? We'd love to hear from you in the last couple of remaining minutes. What have you?
I am seeing in the chat a comment from Deborah Worden, who doesn't have a mic and can't speak directly. So I'm going to read that for you. It says, "I'm not sure if it says there are many places that don't even have cell phone service, let alone Wi-Fi. While we have embraced using these new platforms, we have also gone old school and sent out newsletters to keep people connected."
Wow.
Nice.
Hey, look when all else fails, printed material in the mail sometimes works, or drop it at their doorstep, whatever you have to do to let them know you're connected and you're thinking about them and services are available. Very good.
It's that old school, that mail, I have to tell you, I find myself going to the mailbox these days where, for a long time, I would forget for days. I stop and check the mail. It's so nice to get, even that is a connection. So
it's true. Yeah.
A card, a postcard, just send something out to your coworkers. It's really a nice thing to find.
It is. And it's something tactile and it's something they can remember. And even if it's a card put on their desk or a picture or something like that. Absolutely. Anything else from the field, Holly, that you see coming in over the chat box or the Q&As?
That's all I'm seeing right now.
Okay.
This is Aileen. What I'd like to share is that what the electronic formats have offered us is an expansion to our service group, really. Because before it was a support group where the people who could get together, well, now everyone can get together.
Yeah.
So we've had expanded support group participation, and that's, on the agency level. But on the community level, as you mentioned, the trade associations, our Rotary Club now has people who drop in from all over the world, because we're on Zoom and that one's not secure, and it's on the Rotary website, and so people stop in for a Rotary meeting to find out what's going on the St. Lawrence River. It's kind of fascinating.
Yeah, it's true. Yes, I mean, you're becoming more connected in a way that you're disconnected. So one thing leads to another. It really is fascinating to watch and to experience. Anything else, Ms. Holly, that you see?
Not from me, Ron, just the observation that we are social animals, and we will find a way to connect one way or the other.
That's right. And if we were doing this in person, I'd wish you all a great day, but I want to thank you all for sharing your best practices with us today. And we appreciate your engagement, and also we appreciate Holly Cargill-Cramer from ADG. And most of all, we appreciate all you do for our communities all across the state, day after day, year after year. Now, we've uploaded some items for your use to the chat box, so pay attention to that. Another reminder, please complete the evaluation form that you will be getting in the emails, and we value your input and encourage your ideas for future programs. Now, take out a pen or pencil or even on your computer, mark your calendar to join us in 3 weeks for part 2 in this series, and that will be called Managing Disruption and Continuing to Deliver. That will be on Thursday, July 30th from 10 to 11:15 a.m. I will be there hosting, and we'll have Amy Nitza. She's a PhD and the director of the Institute for Disaster Mental Health at SUNY New Paltz. That will be an engaging and very informative program. I encourage you to attend. Now, part 3, looking way ahead, will be called Remote Staff Supervision. And that will be given to you via webinar on Thursday, August 20th, again from 10 to 11:15 a.m. And I will be hosting that with Donald Kahn, and he is the founding principal of Cateros Performance Solutions, another great program. So please, July 30th and August 20th, we hope to see you all again. Thank you for being with us today. Until next time, be safe and be well. Thank you for showing up.
Thank you, folks. It's been my pleasure to be with you, and thank you, Ron.
My pleasure, Holly. Good to work with you again.